Hello, welcome back. The topic today is can obesity affect acid reflux? Definitely yes. In the previous videos, we have talked about how obesity causing GERD, gastroesophageal reflux disease, or the heartburn, or the reflux, or acid reflux definitely is caused by obesity. How first and foremost increase in intra-abdominal pressure because of the weight, especially central obesity. Even the BMI is also very important, but more than BMI, the central obesity is the worst thing, where the intra-abdominal pressure increases. When the intra-abdominal pressure increases, it puts pressure on the stomach, so that stomach contents, either food or acid, they can reflux back. Number one. Number two, the lower esophageal sphincter, the foot pipe and stomach junction, has a sphincter or a valve-like mechanism where the food can go the one way, but now the valve or the sphincter is relaxed because of the weight, so reflux can happen. Number three, the transit time, the gastric emptying time of the body increases because of the obesity. So instead of 2 hours, gastric emptying, the food stays longer, 3.5 hours, 4 hours. So easily promotes the acid reflux. So not only that, even the intestine movements, the small intestine movements, because these are sluggish. Because of that, the acid can reverse back and come back. And because of the weight, they can get into constipation, but the reflux will be more. Okay, what to do for that? The first and foremost is very simply reduce your weight, especially the central obesity. The waist circumference should come down, and weight reduction. Number three, no meal after 7 p.m. and it should be the light meal. Morning they can have a good, heavy meal, but as days goes by, the food intake should be as light as possible, easy to digest, less oil, less fatty meal. These are very important, and there should be at least 3 hours gap between food and lying flat. So these are the very important thing. And the doctors, they will examine, they ask questions, they can do an endoscopy, they will do endoscopy to rule out hiatus hernia. Hiatus hernia, because of the fat deposition, the diaphragm, the gap increases, the stomach can come up towards the chest, causing acid reflux. So if you have a hiatus hernia, probably according to the grade, the treatment varies, either medical treatment or surgical treatment. And for simple acid reflux, obesity means first is weight reduction, especially the way the tummy has to come down, and the circumference of the waist has to come down. Then no meal after 7 p.m. and night 7 p.m. meal should be as light as possible, mostly steam cooked food, and no lying flat at least for 3 hours after taking the dinner. So these things will help to reduce the acid. And beyond that, if it's really affects their day-to-day activities, probably the doctors can prescribe PPI, proton pump inhibitors, to reduce the acid. They can suggest antacids to neutralize the acid, forms of coating, so they can get relief. So first and foremost, reduce your weight, reduce your waist circumference to avoid acid reflux. Thank you.